Welcome to today's lecture on transposition of the great arteries, TGA, a congenital heart defect where the aorta and pulmonary artery are reversed. We'll cover its molecular mechanisms, pathophysiology, management, imaging, associated syndromes, and the challenges of transitioning patients to adult care. Understanding the anomalies in transposition of the great vessels, TGV, requires an exploration of cardiac embryology. Molecular signals, neural crest cell migration, and key transcription factors contribute to abnormal vessel connections. Further research may lead to targeted therapies. Ventricular septal defects, VSDs, are commonly associated with TGV and significantly influence the hemodynamics in affected patients. The abnormal positioning of the great vessels leads to a parallel circulation, resulting in two separate circuits, systemic and pulmonary. This abnormal circulation increases the workload on both ventricles, leading to volume overload and ultimate remodeling of the heart chambers. Hemodynamically, VSDs in TGV result in augmented pulmonary blood flow, increased oxygen saturation in the right ventricle, and decreased systemic oxygenation. If left untreated, these hemodynamic consequences can adversely affect the patient's overall cardiovascular function. One of the significant challenges in managing patients with TGV is the identification and appropriate management of coronary artery anomalies. Abnormal coronary artery anatomy, including anomalous origin, course, or obstructions, can pose potential risks during surgical correction or interventional procedures. Therefore, it is crucial to obtain detailed imaging studies, such as coronary angiography and cardiac computed tomography, to delineate the coronary anatomy accurately. The appropriate management strategy depends on the anatomical findings and may involve techniques like coronary artery reimplantation or bypass grafting to ensure optimal coronary blood flow following TGV correction. Surgical correction of TGV involves repositioning the great arteries to their correct locations. The arterial switch operation is a standard procedure, but alternative options like the Rostelli procedure may be necessary depending on the patient's anatomy and associated defects. The goal is to achieve optimal cardiac function and minimize complications. In neonates with TGV and severe cyanosis, a balloon atrial septostomy is done to improve oxygenation. This involves widening the communication between the atria, reducing right to left shunting and improving systemic oxygenation. Risks include arrhythmias, dissection, and stroke. Close monitoring is crucial. Following the arterial switch operation, certain complications may arise, necessitating careful long-term monitoring of patients with TGV. Pulmonary arterial stenosis, a common complication, can occur due to neopulmonary artery narrowing or anastomotic site stenosis. This can lead to increased right ventricular pressure and subsequent right ventricular dysfunction. Additionally, dysfunction of the neo-aortic valve, such as regurgitation or stenosis, may occur in some patients. Other potential complications include coronary artery complications, systemic ventricular dysfunction, and arrhythmias. Prompt recognition and appropriate management of these complications are crucial for optimizing the long-term outcomes of patients with TGV. Interventional catheterization techniques, such as balloon angioplasty and stenting, are used to treat residual defects in transposition of the great vessels, TGV, patients. These minimally invasive procedures provide an alternative to surgery with shorter hospital stays and faster recovery times. Expertise and patient selection are crucial for successful outcomes. Three-dimensional echocardiography, cardiac MRI, and computed tomography angiography are advanced imaging techniques that provide detailed information about cardiac structures in patients with TGV, aiding in surgical planning and decision-making. These modalities help detect coronary artery abnormalities, evaluate ventricular function, and identify postoperative complications, leading to improved outcomes. The abnormal vessel positioning in patients with transposition of the great vessels, TGV, has significant effects on ventricular function, shunting, and systemic perfusion. The reversed aorta and pulmonary artery create parallel circulations, leading to increased systemic venous return to the right ventricle and systemic desaturation. This increased volume load on the right ventricle can cause right ventricular hypertrophy and dysfunction. Additionally, the parallel circulation results in varying degrees of cyanosis due to relative arterial hypoxemia. Understanding these hemodynamic alterations is crucial for tailored management strategies to optimize ventricular function and systemic perfusion in TGV. TGV can be associated with several genetic syndromes, highlighting the complex genetic etiology underlying this congenital heart defect. One of the most common syndromes associated with TGV is 22q11.2 deletion syndrome, which involves a heterozygous deletion on chromosome 22. This syndrome is characterized by a broad spectrum of clinical manifestations, including cardiac anomalies. Holt-Oram syndrome, caused by mutations in TBX5, is another genetic condition associated with TGV. The presence of these genetic syndromes necessitates a multidisciplinary approach, involving genetic specialists, for comprehensive management, addressing not only the cardiac anomalies but also associated systemic manifestations. Transposition of the great vessels, TGV, can have long-term effects on the brain and behavior. Factors like oxygen supply, surgery, genetics, and environment contribute to neurocognitive and psychosocial problems in individuals with TGV. Early intervention programs involving various specialists are important for optimal outcomes. Transitioning adolescents and young adults with transposition of the great vessels, TGV, from pediatric to adult cardiology care is challenging. Transition programs are essential to empower patients and ensure a seamless transfer of responsibilities. Collaboration between pediatric and adult cardiology teams is crucial for successful transition. In conclusion, transposition of the great arteries is a complex heart defect. This video has covered the causes, treatments, and outcomes of TGV in detail, helping healthcare professionals provide better care to patients.